have UCL injury and Tommy John's surgery. A little overview of it. The UCL is called the ulnar collateral ligament, and this ligament serves as a tether between bones in the arm. And when it's torn, it can make the bones move too much, causing excruciating pain and a lot of discomfort. Tears to the UCL usually happen from wear and tear as long as prolonged stress to the elbow. Tears are especially common in athletes that require overhand throws, such as baseball players. The prognosis, Tommy John surgery is basically a reconstruction of the UCL. During surgery, a tendon from somewhere else on the body, or someone can even donate another tendon, and it's used to totally rebuild the UCL. Surgery is done to help regain motion as well as stabilize the elbow. And for the recovery process, it can take all the way up to a year, sometimes longer. After surgery, care is crucial and very critical for it to heal properly. And full recovery and return to play could take up to 2 years depending on the athlete. Short-term recovery without the surgery, because you can do it with and without surgery. Initial period of rest is very important. So we need to take anti-inflammatory medicine for it and applying ice to the elbow daily. And when it starts to stop swelling, that's when physical therapy can be started to regain strength in the muscles around the elbow to help with the stability.
So some specific long-term care for the UCL. So you want to start with a posterior splint on the elbow, having it immobilized at a 90-degree angle with flexion for the first 7 days post-op. And then rehab can be up to 1 year, but if the athlete wants to go back to their full potential that they were at before the injury, it could take up to 2 years, again, depending on how the athlete reacts to this and how well they take physical therapy. They're going to always need to be focusing on having that range of motion that they gained back while in rehab, and having their elbow muscles all around it strengthened the whole time. And then they're always going to be at risk for this surgery, for this injury. So that's mainly it for long-term care. They just have to watch out for getting this injury again if they don't properly take care of it. So for progression and modes of exercise at each stage, there are 4 phases. The first one is going to be the immediate motion. This phase focuses on minimizing the effects of immobilization, reestablishing non-painful range of motion, decreasing pain and inflammation, and stopping atrophy of the muscle. So some examples of this for exercise would be active assisted and passive range of motion exercises, ice and heat to help with the inflammation, and scapular strengthening exercises. Phase 2 is the intermediate phase, which is initiated once full range of motion has been achieved. They have minimal pain. It includes maintaining and enhancing elbow musculature, improving strength and endurance, and starting to reestablish that neuromuscular control. Some examples of this would be isotonic contractions, beginning with concentric and going to eccentric, and glenohumeral and scapular thoracic muscles being placed on a progressive resistance program, which could be the Throwers 10 program, which will be explained later in this video. Stage 3 is the advanced strengthening stage. The focus is to strengthen all of the areas needed to return to play. They want to gradually increase their strength, power, endurance, and neuromuscular control. They want to have full internal and external range of motion, and 70% of their strength gained back before starting this phase. So examples of it are higher resistance, function movements, eccentric contraction, plyometric activities, strengthening with weight machines, or continuing that Throwers 10 program and adding in some plyometrics. Stage 4 is the return to play stage. So they progressively return to play, but they want to do it in intervals, which are normally set up by their physical therapist in rehab, and isokinetic testing to make sure that the athlete is at 100% so that they're ready to begin to play.
Okay, so hi, my name is Erin, and I did the specific strength exercising used during rehabilitation and specific neuromuscular exercises used during rehabilitation. First, I'm going to talk about the strengthening exercises used during rehabilitation. Previously, so Megan had mentioned that there was 10 program. Also, there is a full multi-phase rehab program that the pitchers will have to go through after Tommy John surgery. So step one, once you regain full range of motion, they want to strengthen the elbow joint and the area around it. Step two, once step one is fully completed, the program becomes more aggressive, so specific high-speed training, plyometrics, just to get the player back to the rigorous task of throwing and at that high speed. Step three is interval pitching, so the pitcher and the catcher will throw on a flat surface and they'll be at close distance, and little by little they will increase that distance to the point that it's the same distance as home plate and the mound, but of course staying on that flat surface. That way the pitcher can just work on the pitching mechanics that are required before adding in the factor of speed. Okay, so now we're going to talk about the specific neuromuscular exercises used during rehabilitation. So there's a lot of different dynamics that go along with pitching, and specifically it's balance and coordination. So pitchers will have to find that proper balance while coordinating the movement of throwing while stepping and being accurate. So staying balanced while on one leg and transferring energy from your lower body to your upper body into your throwing arm requires the body to be strong, not only in the shoulder here, but have that awkward movement in the angle here in the elbow. So when you have your UCL surgery, we're going to go back to the strengthening exercises. You want to make sure you have your elbow joint and the surrounding area strong, because when pitchers are throwing, they do have that awkward ankle that's not natural. So for the neuromuscular exercises, we want to step and work on those mechanics while also working on the balance and coordination, because like I said, it is a very awkward ankle for pitchers to throw, especially after Tommy John surgery. Like I said, it doesn't come naturally, so they just have to work back from point A to point B, so from beginning to try to work up to where they were. So I actually have a couple of my friends, they got Tommy John surgery. They both had torn UCLs, and on the left here, my friend actually tore his UCL. You can kind of see it here, just like the inflammation, and it's swollen. This is after he had surgery. You can see the stitches, and here is when the stitch was taken out and it was healed. See how he couldn't strengthen it though? And this is when he was back in physical therapy, and he was working on slowly regaining his mobility to straighten it completely. And on the right here is my second friend who recently just got the surgery. You can see here how they made the incision and how it goes all up his arm, because he had a torn UCL in different parts. So I have some connections with it, so I thought that was cool.
I will be closing with future considerations for the UCL injury. So an athlete should perform strengthening and stretching exercises, and not only on their arm, but they should strengthen and stretch everything else, including like their hips and their core, because that is used a lot when pitching. An athlete should avoid pitching when fatigued. That is a huge risk factor for UCL injuries. And some ways to prevent injury is to follow the specific pitch count, which will vary depending on the level of play. Try to stay under the speed of 85 miles per hour if you can, and play less than 8 months in a year. You don't want to